Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified a bunch, and you know, we've been here before many years ago. Hold the camera here, please. 2 hands. So we're just going to have a look around and confirm that that rotator cuff is indeed torn. And if it is, then we're going to get right to work. So right off the bat, we can see that you've got a fair amount of frayed labrum here and some arthritis in the glenoid. Remember that on these cases, these shoulder arthroscopies that we do, you're laying on your side, so your arm is up in the air. Your biceps tendon was already torn, and it looks like it's still hanging on, but I think we're going to have to go ahead and release it today, so I'm going to need a spinal needle shuttle relay free suture. And so we'll do a biceps tenodesis today as well. We can see how patchy this repair is. There's multiple holes in it. There's some of the old suture material. So we're going to go ahead and look and make sure there's nothing else inside the joint to worry about here. So as we rotate and look down the back, this looks okay. We're going to lift up on the shoulder and see if we can get to that little bit of labrum that looks like it's got some tearing in it right here. Okay, now that's been smoothed out. We'll look down the front of the shoulder and pull back now on the arm. Not too hard, yep. Here's the subscapularis. It's a little bit frayed, but not too bad from what we're looking at here. You can relax on the arm. Okay, so here's the tear. We can look to the back here. We can see how it's going to take probably at least 2 anchors. I'm not sure if we're going to use all suture anchors or metal yet, but the back of your shoulders to the left, the front of your shoulders over here to the right. We're going to go ahead and see if we can't retrieve the biceps sutures. Crochet hook. We'll show you some more in a minute. Okay, so we're just planning our repair. This is the infraspinatus side of the tear. You can see how it extends all the way down, and we're going to try and get our first anchor way back here. So something like this. We may even internally rotate the arm a little bit. Hold the camera there. Because if we do that and internally rotate a little bit, we'll get even farther back. Okay, pause please. And turn to the right. Okay, so there's our triple loaded anchor. It's an all suture anchor. And we'll decide which sutures we're going to work with first. Take this one out right here. Okay. So now we're going to tie these sutures one at a time after we pass them from left to right on the screen. So just get your last good look at that big tear. We're going to start closing that up. Okay, so we've tied the first 3 sutures from the first anchor. You can see that's tied right there. Okay? We've still got this big tear. Look, that's just kind of the opening blow in this battle here. We've still probably got 2 more triple loaded anchors, probably a bridge, or not a bridge, but a biceps tenodesis rather, and then a bio brace on top of all of this. So we have a lot of work to do, but I just want to show you we're making progress. Do you have the punch, the mini Revo punch? So we've got 2 triple loaded anchors tied and a biceps tenodesis done. And that's all moving pretty solidly as a unit. I think we're going to leave well enough alone and call that good. I'm happy with the way that looks. That hole's completely eliminated. We've got all our sutures tied in a single row right at the articular margin. And you can see as I rotate your shoulder, that's not going anywhere. We're going to go ahead and use our last little biology trick. Which is where we take the little punch. We don't want to go right here because that's where the anchor is, but we sure want to go into the tuberosity back here. Tap down. Okay, so there's 1. This is a big enough tear we can make a bunch. There's 2. Here. There's 3. And gently here. Go all the way. There's 4. So that marrow space has been opened up. We'll go ahead and get you back to the recovery room shortly. Good luck to you now. Bye-bye.